Hey there.
Hi.
How you doing? What in the world is up, guys? So I'm back with another video, and today I'm going to be making part 2 of the What is SLE video series that we started last week. I'm going to be talking about the different signs and symptoms, as I mentioned, and as you guys remember, we talked about how some symptoms can be a result of your lupus and other symptoms result from the actual treatment that you receive to try to manage and control the symptoms. Hopefully, if I don't talk too much, I'll probably get into a little bit of the possible causes of lupus and even the whole diagnosis process, how to diagnose a person with lupus and all that stuff. So let's get right into the video. Of this video is to distinguish between symptoms that could be a result of the actual lupus, your health condition, where this chronic inflammation builds up, and the other half, which is the actual result of your lupus treatment, things like your medication, things that you receive to try to manage and control those symptoms that are already there. So although there isn't a confirmed cause for lupus, there are, you know, what I like to call hallmark symptoms that are kind of like your most common symptoms specifically found in lupus patients. And so I'm going to be talking a little bit about mainly those symptoms. I do want you guys to know what they are. I'm just going to put them up here in case anyone wants to kind of just monitor their symptoms, see if they might fit into certain categories and things like that. But it's not to say that if you are experiencing a symptom that's not listed up here, that it can't be lupus, because you guys have no idea how many times I've seen online people complaining about how they don't get sufficient help for something like an abnormal or unknown symptom. It does happen a lot, where you'll experience a symptom that your rheumatologist or your physician might not necessarily know, tied to lupus. And so yeah, but I'm gonna keep these up here. The ones that I have up here are actually what I think are the more common, the ones that your physician might be the most familiar with. But again, it is a complicated condition, so of course that's why there's so much confusion in terms of the symptoms and things like that. A lot of the times the unknown or the abnormal symptoms that doctors don't really know how to deal with are often really painful or uncomfortable, and so I do want to put that out there that it is a possibility. I do want to advise you guys that whether you have lupus or if it's another autoimmune disease or any sickness for that matter, I think that the most important thing in terms of your symptoms is to always keep track of them. You know, if you have to write it down on a notebook or journal it, just so that you don't forget, that's even better, because that is how you're going to be better able to communicate your symptoms and discuss them with your doctor or whoever's working on your case. I really can't stress that enough to you guys. At least for me, one day I was mentally stable, you know, like any other person, and then the next day I was like hallucinating like crazy. That's like probably a really bad description of like hallucination, I'm sorry, but it was all, you know, kind of a result of like a mix of the side effects of my medication and brain fog, which is also a common symptom of lupus, where you can easily forget things, you have a shorter attention span, and your just overall cognitive skills just go out the window. And then on top of that, you're feeling all these other unrelated symptoms to your nervous system, and because of your lack of memory and your ability to explain things, it's just overall a frustrating process to deal with all these different symptoms. I literally felt high all the time, like, even though I've never smoked before, but I literally felt high all the time. Like, I could just tell, like, always like loopy and stuff. So but yeah, so basically the only way that I could really discuss these things with my doctor was by making sure I recorded everything, like even the smallest symptom that I felt. I would record it so that I wouldn't forget it at the time that I had my appointments, you know. And I will be honest, I don't necessarily do that as much now, even though I should. I think that even if you feel that you're eventually getting better, you still always want to write them down, because you know, lupus is that type of condition where it will switch up on you like out of nowhere. So you never know if one day you're gonna be okay and then the next day you're gonna be forgetting things all over again. So it really is important to keep track of these symptoms. And so for me, at least, one of the most difficult symptoms to deal with were the ones that affected my neurological senses. But of course, everyone is different, as I mentioned in my last video. And you know, one of the, like for example, one of the main symptoms, I guess I would call it the hallmark symptom of lupus, is what they call a malar rash. And that's also called a butterfly rash because of the formation that it makes. It's usually found on the bridge of your nose and also like on your cheeks. And so for me, I didn't really have a lot of difficulty with that. Like if I get it, I usually it just looks like I'm wearing regular blush or something. But for other people, it like takes over their whole skin, and it completely bothers them. It's so discomforting for them. It can vary with symptoms, and so because I don't have too much experience with that, I'll kind of just go into the ones that I personally experienced. And so let's see, so I actually experienced joint pain and joint swelling, you know, swelling of the body, extreme fatigue, shortness of breath, anemia, weight loss instead of your usual weight gain, and chest pain. And that's actually key, and because this was all kind of happening when I first got diagnosed. That was kind of all happening around the time that COVID first broke out in the United States. And so me having the chest pain and the shortness of breath and the constant coughing, like I legit thought I had COVID. I thought I had COVID. And so it wasn't until I got into the emergency room and they did all these tests that I realized that those symptoms were actually a result of the inflammation and the water that was building up in my lungs. And so it had nothing to do with COVID, and it had nothing to do with medications or anything like that. Like that directly was affected by my lupus. And so it's very important to kind of know the difference between the two. Like another great example would be like an unexplained fever. A lot of the times people will go into the hospital with an unexplained fever when they have lupus, and like just think about that's like a very general symptom that could be categorized by a whole bunch of sicknesses. Even a mild flu or anything will give you a flu, or not flu, a fever. Even that can be a result of not your medication but your actual lupus.
Oh, okay.
If you remember in the last video we talked about how your immune response is confused, and it kind of just assumes that you have a pathogen that it has to kill in your body, when really it's confusing it with your healthy body tissue. And so as a result of that, it will raise the temperature of your body to try and kill that non-existent pathogen that's not there, and it will just kind of leave you with an unnecessary fever. A lot of the times that will happen. A person will go in and the doctors or the nurses, they'll go ahead and try to test, you know, try to find a pathogen, and they won't find it, and they'll kind of just be confused. Why does this person have a fever? And that's actually a result of lupus. And let me tell you something, because lupus really isn't the most common health condition. So I even had nurses that weren't the best experts on this health condition, and so a lot of the times it would be confusing for them when they would take my vital signs and see certain things like that temperature or your blood pressure raised to the roof, even though you're like kind of fine and all that. So yeah, nurses, you know, be aware of all those different symptoms as well. If you're going into the nursing field or the medical field, you know, just be aware, because I had one nurse actually, like I don't know if she was new or something, like she like almost like she didn't faint. I'm not gonna like over exaggerate, but she was like literally like like dying, like about to get like the doctor, like she went to go like complain to another nurse that my blood pressure was like over the roof, even though like for me normal blood pressure around that time or whatever was 140, 130. When I first got diagnosed, it was 150, 160. So at that time, it was starting to get stabilized. And she didn't know that that was normal at the time for me. And so she was freaking out, like, oh, this girl she's about to have like some sort of thing. Like, they don't want to let me go in the hospital until my blood pressure was normal, when that wasn't gonna happen anytime soon. I was basically fine, and they still wanted to keep me because they didn't know that was just being affected by my lupus. So see, she was reacting, and I wouldn't say overreacting, she was just overly anxious about something that could have been focused on something else. So, but yeah, as you guys can see, these symptoms can range first from something mild, such as a headache or a fever, to very severe symptoms such as, you know, your shortness of breath, neurological symptoms such as those that cause seizures, stroke, even heart attacks. And so yeah, it's very important to keep in mind all these different symptoms. I know a lot of the times these symptoms can be scary, and you know, I don't care how strong or spiritual you think you are, we're all human, and you know, we're gonna be prone to some extent experience or even think of some dark things when we're feeling hopeless, or when we have or when we get frustrated for not understanding certain things. And so let me tell you guys, I actually went ahead and posted a while back on my Instagram a picture of my I guess like a report of how I was doing a little bit further. I think it was like 6 months into treatment, and it was captioned, "Science is something, but Jesus is everything." And when I got to accept that, I guess that's when my whole perspective changed on my whole journey with treatment and everything like that, especially through those first few months of treatment, because for me at least those were the hardest months. And so that's what has helped me. Once I kind of changed my perspective onto that, then that really helped me to view things in a different way and tackle whatever struggle that I was going through in a different way. And so, you know, just before anyone comes to a conclusion about that, what that caption means, I'm kind of just gonna tell you this because, for example, like, obviously when you're first getting diagnosed, you're going to see all these different doctors, you know, even ones that you're not necessarily going to have later on in the treatment process, but, you know, you're getting all these different opinions on doctors, people who have health and science degrees, who know what they're talking about. And even then, they would come up to me and tell me, hey, you kind of have an abnormal case. You might have to put you on dialysis because your kidneys are failing you. You're only working at about a rate of 20%. And plus you have all of these infections in different organ systems. We really don't know how you're going to be able to handle certain treatments or how to go about the whole treatment process. And so that's scientifically speaking. And then I also had people telling me, you know, we know how you feel, but the more you focus on your pain, the less you're focusing on God, okay? So don't let your pain be an excuse or excuse you from not reading your Bible. Try not to focus too much on the situation, because at the end of the day, this life isn't about us, and we don't necessarily deserve our health in the first place. So it would be kind of selfish for you to be just focusing on your pain 24/7. Get frustrated on both sides because both groups were advising me ultimately from a source of truth, but I learned that you can't advise a patient going through something new like this without acknowledging the other side. So the science and the faith, I think that they go hand in hand. You can't just ignore one or the other. Especially if someone is is in the middle of feeling such pain, it can dramatically help them if the doctors are also grounded and open to practicing with a foundation of faith, you know, meaning that they believe in the impossible and they're gonna care for that patient regardless of what the numbers say, hoping that that patient is gonna get better. You're gonna put the same amount of effort and care in the person that is gonna be discharged within a couple of hours that you are towards the person that you have no idea whether or not that they're gonna be able to handle a certain treatment. Okay, I don't care if you don't believe in anything, but there are 1,000,001 cases of faith being a major factor in fueling the healing process of a patient. And all the religious fanatics are like, yeah, tell them. No, I'm gonna come after you too. Because, you know, as for the religious fanatics, you can't practice your faith without acknowledging the reality of this world and our humanity. You know, sickness, struggle, our weakness, they're all part of this the reality of this world. And we also have to acknowledge the value of mourning. You know, the Bible, it says, blessed are those who mourn, for they will be comforted. All of that stuff is part of our humanity. You know, I was one of those people, actually. I wanted to believe that the pain that I was feeling was all kind of in my head, and that, you know, if I tried hard enough, then I could distract myself or even escape from whatever it was that I was feeling. On top of that, I was consumed with your typical Bible study routine, and, you know, I even got sad. Like, when I started treatment, I got super depressed because when I wasn't sleeping, which eventually was never, because those steroids will make you just sit there for 24/7. Eventually you become an insomniac with those steroids. And so it got to the point where I was always just crying of pain and hoping that it would just end. So I would say I would be mad, and I would say, Lord, how am I supposed to get closer to you now? I haven't even been a Christian for years, let alone expert, and you're putting this test on me. Like, I'm not ready for a test like this. You know, my resolution was to grow more intimate with you and to get to know you better. And how am I supposed to do that when I can't even read or write? My hands are shaking all the time. I can't even open your word. How am I supposed to get closer to you? You know, but when I just kind of gave that routine up of having to get a devotional in, that's when I really felt that he made a way to get closer to me, for me to feel his presence, and ultimately that's when I felt closest to him. So I hope that you guys understand that my point is that you can't have science without faith, and faith without science. It's just not logically accurate. We have to accept the fact that we're not invincible. You know, we see in the Old and the New Testament time and time again examples of people who lose all of their strength and are feeling, you know, too weak to the point where they can't do anything religious, and they just have to accept their weakness and their humanity and their pain even, and let God do the rest. And, you know, we're only human. So that's just, personally, I think that we have the right to acknowledge and to just sit in our pain for a while. You know, sometimes that's the biggest effort that we can put forth instead of giving up altogether. And I think that by acknowledging our hopelessness, that at the same time we're also acknowledging God's power and grace. And yeah, so yeah, keep that in mind. With that being said, make sure that you guys, if you have the opportunity to find out the explanation for why you're feeling certain symptoms, that you don't hesitate to ask, because a lot of the times, just by simply knowing or having an explanation for these symptoms, that helps relieve your anxiety so much more. You know, when it comes to your health, there's no time to be like shy or you know, oh, I'm scared that I might be asking a dumb question. No, okay? That's how we learn if we're feeling something that's a result of our actual disease, or if that's just simply a side effect of our medication we're feeling, and if there's any way that we can manage it. Let me just put it in perspective. So lupus itself doesn't necessarily make you gain weight. Almost everyone who is diagnosed with lupus is put on some sort of steroid to try to control the inflammation, and that will then cause the weight gain. A lot of people take stuff like prednisone to try to help you control the inflammation until the other medications that you're prescribed start kicking in. If they take a while to start kicking in, they use the steroid to kind of boost that effect. Like, literally one time I almost had a heart attack because I didn't know about things like hallucinations from your treatment. So sometimes, hello, trying to film. So sometimes I would see, like, for example, like my nails, they would be like simultaneously like growing before my eyes, and that like freaked me out. Yeah. And then one time I like saw my dog like losing an eye, like his eye started like fading out, and I thought that was my fault. And I was like, he's never gonna have an eye ever again because of me. Because let me tell you something, even though obviously, like, logically thinking, like, logically that's not even possible. How can I make my dog's eye disappear? That's just not possible. But it looks so real, like, it just freaks you out to the point where you're like thinking it's real. You have to tell yourself it's not real, it's not real. Clearly he has two eyes. Just look at him, look at him, look at him. Clearly he has two eyes. Say hi. He's looking at me like I'm crazy. But yeah, and then there's like one time I was like on my bed and I felt like my body disinflating like the balloon, and I thought it was legit. I thought I was going to like melt and die, to the point where I called my mom at work. I told her, I was like, I'm gonna die, I feel like I'm melting and all this stuff. My brother and my dad had to run in the room and all this stuff, and so we called my nephrologist, which is my kidney doctor, and he gave us this whole reasonable explanation for why my body was feeling that way. And he told me, hey, just stand up. And when I stood up, I was completely fine. And so whenever it happened the next time, I was more aware of the, you know, scientific explanation. I was more at peace about feeling the symptoms, even though of course it's very uncomfortable, but you still are able to handle it better emotionally. Same thing with my hand tremors. I thought that because I was going to school to be a vet, and so I thought I knew everything about science, why I was feeling this symptom or the other symptom, and I was like thinking that the hand tremors were a result of my actual lupus because it was affecting my neurological senses. And so I thought, oh, I'm gonna have this forever, you know, because lupus is something that I'm gonna have forever, and so that means that I'm gonna have the hand tremors forever because they're affecting my nervous system, and the nervous system controls, like, you know, the hand shaking and all that stuff, when really it was actually a side effect of my medication. And once I found that out, I was more confident about, and I was more calm about, well, at least I'm not gonna have to worry about having this for the rest of my life. That's often a side effect of, like, for example, prednisone, which is one of the most popular steroids that they prescribe to lupus. And so after, I guess, about like 2 to 3 days after I stopped the medication, then the hand tremors went away. So it really does help to know what causes the symptoms. Sometimes it's a matter of your lupus, sometimes it's a matter of your medication, sometimes it can be both. Like, for example, hair loss can be affected by both your medication and lupus itself. I didn't know that you could get inflammation in your hair follicles, so I thought that it was a result of the medication. And then when I went to go see my hematologist, he told me, hey, you're not really taking any medication that causes extensive hair loss. You most likely have inflammation in your hair follicles, and that's what's causing all of this hair loss. So yeah, think about the science and the faith. They go hand in hand, and that will ultimately just help you guys to deal a lot better with the symptoms. But y'all, that brings me to the end of the video, and I just wanted to take the time to thank you guys, anyone who's been subscribing to the channel, because, you know, I don't necessarily care too much about the views and all that stuff, but obviously the more that we're able to build this community, the more able it is to reach people who actually need the information. And so that's the only goal that I really want. Of course, I talk too much in this video, so I'll just have to make a separate video for the possible causes of lupus, the suspected causes, and the diagnosis process. So stay tuned for that next week. Okay guys, see you guys, bye.